Good day, friends. The Juvenile Justice Committee of the High Court of Karnataka, the Karnataka Judicial Academy, the Karnataka State Legal Services Authority, and SAMVAD welcome you to this special session on protection and mental health concerns of children in the COVID crisis, implications for systemic approaches. We are privileged to be joined today with Honorable Justice Oak, Chief Justice, High Court of Karnataka. We hope that Honorable Justice Bhatt, Judge Supreme Court and Chair of the Supreme Court Committee on Juvenile Justice, perhaps also join us. This is a very critical session given the state of the pandemic, particularly the second wave and the imminent third wave, which is likely to come in October or November. To start the proceedings, it is my honor to invite Honorable Justice B.V. Nagaratna, Judge, High Court of Karnataka, and Chairperson of the Juvenile Justice Committee of the Karnataka High Court, to give us her introductory and welcome address. Justice B.V. Nagaratna, my friends. Over to you, ma'am.
Thank you, Doctor. A very good morning to everybody. Honorable Justices Ravindra Bhatt, Judge, Supreme Court of India, and Chairperson of the Juvenile Justice Committee, Supreme Court. Honorable Chief Justice Abhay Srinivas Oak, High Court of Karnataka. Honorable Chairpersons and members of the Juvenile Justice Committees, High Court of Karnataka, and all the other high courts. Esteemed sister and brother judges of various high courts, chairpersons and member secretaries of the state legal services authorities and state judicial academies who have joined, chairpersons and member secretaries of the legal services authority of the state of Karnataka, learned judicial officers of the Karnataka Judicial District Judiciary, officers of the Department of Women and Child, Government of Karnataka, Dr. Shekhar Sheshadri, MD Psychiatry, and Ms. Sheila Ramaswamy, and their team at SAMVAD-NIMHANS, distinguished invitees. As already mentioned by Dr. Shekhar Sheshadri, on behalf of the Juvenile Justice Committee of the High Court of Karnataka, Karnataka Judicial Academy, Karnataka State Legal Services Authority, and in collaboration with SAMVAD of NIMHANS, I extend a warm welcome to each one of you to this program on protection and mental health concerns of children in the COVID crisis, implications for systemic approaches. I wish to keep my address very brief so that we have more time for today's speakers and to delve into the subject. The outbreak of the coronavirus pandemic is of an unprecedented scale. We have not witnessed a pandemic of this nature in recent times. It has claimed lives and livelihood of several persons across the globe. The challenges posed by the pandemic is not limited to physical health and well-being, but has also extended to socio-economic aspects. The pandemic has resulted in a situation where extant institutional mechanisms, not just in the healthcare domain, but also socio-economic spheres, may require a relook. The challenge posed by the pandemic is further exacerbated by the fact that it has called upon to take swift action with very limited historical data to guide us. Even in the realm of child rights, the raging pandemic has posed several serious challenges which call for urgent and immediate action. As we all know, children hold the key to the future of any nation and society. They are one of the greatest gifts to humanity. Therefore, it becomes the collective responsibility of society and those in charge of governance, and justice to ensure the well-being and protection of the rights of children. Unfortunately, the pandemic has proven to be an adverse impact on children, starting from their physical health, mental health, ensuring that they continue to have access to education during the lockdowns, their physical safety and protection, and their custody and guardianship in the event they lose their parents and caregivers due to the pandemic. We have gathered here today not only to identify the challenges to children's rights posed by the pandemic, but also to discuss responses which institutions tasked with enforcing child rights may adopt and evolve in order to address these challenges in the field of mental health. Fear, anxiety, insecurity, stress, anger, hopelessness are all emotions that need to be addressed. With these words, I conclude today's address and thank each one of you present here today for sparing your valuable time to participate in today's webinar. I thank Dr. Shekhar Sheshadri and his team for agreeing to share their views on today's subject. I am sure it will be a fruitful exercise that will translate into meaningful action. I would like to conclude my introductory remarks by encapsulating the aim of today's program in the following words as stated by UNICEF. Quote, we have to work together to make progress on three fronts: information, solidarity, and action. We have a chance not only to defeat the pandemic, but transform the way in which we nurture and invest in our future generation. But we have to act now. We have to act decisively and at a very large scale. This is a clarion call for the world's future and world's children, unquote. Thank you. I now request Dr. Shekhar Sheshadri to take over.
Thank you very much, Honorable Justice Nagaratna, for those very important and significant thoughts that you have shared in your opening address. It really sets the tone for what we wish to share with all the people who have joined us in this session, both on Zoom as well as on YouTube Live. The pandemic is something that has been unprecedented in the lives of all people. Let's take a look at the first wave. What happened in the first wave? From a health perspective, it was noticed that the disease and mortality in children, the severity of the illness was low.
Good day,
Only
friends.
young children under 10 years of age were more at
The
risk
juvenile
and required aggressive treatment. But children could be carriers. But there was psychological issues and problems due to the lockdown and restricted mobility. Because look at what happened to children's lives. Loss of routine, loss of structure, loss of predictability, loss of learning opportunities, loss of social spaces, loss of peer interaction, and loss of play. The other issue was also emerging protection risks for children in difficult circumstances, because you will recall what happened in the first wave, particularly with the panic that set in and the issue of migrations and the predicament of daily wage workers and migrant workers and loss of income and livelihood, that protection risks, particularly of trafficking, of child marriage, of child labor, were prominent issues that people in child mental health, in the realm of child rights, judiciary, civil society organizations, and indeed all stakeholders and service providers who were concerned about the state of children thought about, agitated, cogitated about, and then a lot of stuff was done to address some of these issues from both the perspective: psychological problems due to lockdown and restricted mobility, and the emerging protection risk for children in difficult circumstances. So, what do we mean when we speak about lockdown and restricted mobilities, COVID blues and anxieties? What exactly did children experience? What are they experiencing now? And what might they continue to experience as we deal with the waning of the second wave and perhaps the emergence of the third? Let's examine general psychological impact on children. When social and physical isolation take place, it gives rise to psychological distress because these are unusual experiences for children who have hitherto gone to schools, been in an ecology which was very different. So when there is a change, external and an internal ecology, and you're forced to adjust to restriction, constriction, it gives rise to exactly the kind of emotion that Justice Nagaratna referred to: fear, anxiety, anger, irritability, and so on. If you look at the impact on families, the loss of income and livelihoods that I referred to, and then the kind of anxieties that are created in the family, and if these give rise to parental stress, in those families there is already existing strife, already existing domestic violence, already existing parental discord. The difficulties of enduring the consequences of this stress, compounded by loss of income and livelihood, gives rise to a family environment that is characterized by emotional abuse, by physical abuse. And this is where, in more vulnerable families, the risk of child sexual abuse emerged as we entered into the first wave, and it is continuing. If you look at the figures that came from Childline India Foundation and the number of calls they received in the weeks and months that followed in the aftermath of the first wave, and the kind of response that state systems took, and civil society agencies, the judiciary, and all service providers and stakeholders to really address these emerging risks and the kind of psychological impact that it causes on children. Add to this the disruption that took place in their routine, a disruption to access to education, and the impact of online classes in those children who had access to education, but the isolation continued. And for older children, when will there be exit exams? Will there be a gap here? What about all the aspirations that I had in terms of my future and professional courses? And if you do the math and put all this down, we are looking at a compounding psychological impact on children. But the context of pandemic and its impact on children in difficult circumstances, what I referred to hitherto was a general impact on all children. But if you look at children from vulnerable situations, from difficult circumstances, the lockdown and its economic impact on poor and vulnerable groups, the kind of circumstances that many children in need of care and protection and children in conflict with the law are drawn from, exactly the two constituencies that form the structure of the Juvenile Justice Act. In more economically vulnerable populations, if they are migrant workers, people in informal sectors, the agriculture sectors, daily wage farmers, what happened in the first wave? There was a sudden loss of livelihood and income, poor access to food, poor access to shelter and other basic needs. Now, these were people who already had difficult existences. And these were exacerbated. And whatever little resources they had would be consumed in times of disaster, resources that they have saved. If there, thus there is a slow recovery of global economy, including our economy in this country, to recover from the losses and impact of the pandemic, there will be rising hunger among those who work in the informal economy. And if you look at the lives of migrant workers and their families who have difficulty in making ends meet as they returned to their villages. Let's delve a little deeper now into the heightened vulnerability of children living in difficult circumstances. Now, these are multi-level risks that all of us need to consider. Look at the pre-existing demographic and psychosocial vulnerabilities of those who come from adverse circumstances and add to that the impact of COVID. If you look at CNCP and CICL children, the fact that they came from poor socioeconomic status and families that were characterized by issues of unemployment, families who were daily wage workers or in migrant labor, families where incidents of physical or sexual abuse were already present, families where traumatic experiences of loss and bereavement had already taken place. There might have been chronic situations of neglect, experiences of discrimination and bullying, and the presence of parental marital conflict, marital discord, perhaps even the witnessing of domestic violence that cause family stresses. If these heightened vulnerabilities are compounded to several degrees of severity by the socioeconomic disadvantages that COVID places. And let us recognize here that pandemics of the nature of COVID have a disproportionate impact on the more vulnerable populations. The kind of protection risks that it gives rise to, and let me take you now through the kind of risks that we are talking about. First, I refer to child labor. If you're suffering from hunger and the burden of supporting families, both male and female children are at risk of being trafficked for labor. Perhaps a higher risk in male children. Child labor and those children in child labor are equally vulnerable and even more so to different forms of abuse and violence. And then the danger of being exploited sexually and forced into sex work. And we know from our existing experiences where child labor is concerned that children have always been exploited by the labor industry. And in crisis, they are forced to accept even lower wages. And since they cannot unionize, an added advantage for industry that is currently looking for cheap labor. And one needs to be vigilant and alert to the first aspect of child labor protection risk, which is child labor. Then there is sex work and trafficking. If you look at children from adverse childhood experiences of neglect, of parental discord, of poor supervision, they are at risk for trafficking for sex work. And if you superimpose the economic crisis resulting from the COVID-19 pandemic, this has further increased this risk. In vulnerable and displaced populations in emergencies such as the pandemic, these are the kind of children who are likely to be preyed on by traffickers. And the risk of food for sex exploitation is higher in emergency situations. We know this from the last 50 years internationally about what happens in emergency situations. And there is enough evidence and enough literature on this aspect. If you look at the third child protection risk, which is the issue of child marriage, girls from low socioeconomic background are married off before 18 years for reasons simply relating to poverty and the perception of the girl child as being an economic burden and the lack of awareness in education in this context. In the COVID-19 crisis, as indeed in other disasters, due to adverse economic impact on most vulnerable households, there is the increased risk of child marriage. Now, what do vulnerable households do? They adopt coping mechanisms that include reducing the household's existing burden and expenditures or size. So you adjust the number of children under the family's care by simply marrying the girl children off. The fourth child protection risk I would like to speak about is child sexual abuse and maltreatment. We know, friends, that even in normal times, child abuse can go unnoticed. In times of a pandemic such as COVID-19, due to social isolation is a major risk factor for all kinds of abuse of children, physical, emotional, as well as sexual, because there is limited access to early warning systems. What are these early warning systems? They are decreased social activity, withdrawal from preschool, school, community, and youth programs. If you add to this the lack of contact with wider social networks of friends and families due to quarantine, social isolation, add to this the financial uncertainties resulting from the current pandemic, these put children from low-income families at high risk for abuse and neglect. To put this in perspective and look at the mental health impact. So all the child protection and psychosocial risks that I've spoken about and the vulnerability of children in adversities in COVID times. On the one hand, you have protection and psychosocial risk for children in vulnerability. And on the other, you have mental health impact of abuse and other protection violations. So we've gone through this list: child marriage, child labor, trafficking, abuse and exploitation, nutritional and disorder disease issues, issues of injury, and God forbid, mortality. From a mental health perspective, please refer back to the points that Honorable Justice Nagaratna made in her introductory address when she spoke about anxiety, fear, which we call as internalizing disorders, issues of adjusting to what is now referred to as the new normal, but the new normal brings it with several unpredictabilities and imponderables. Depression. Those children who have experienced trauma, the trauma of loss, the trauma of abuse, the trauma of being personally ill and hospitalized, causing post-traumatic stress disorder. Then you'll remember that Justice Nagaratna referred to anger and irritability and acting out behaviors. Now, these are behavioral end expressions. We call them externalizing disorders: anger and aggression, runaway behavior, substance abuse, and other high-risk behaviors. But whether we are talking about internalizing conditions or externalizing, they are both related significantly to what we call as life skills deficits in children, which are inadequate skills relating to assertiveness, to negotiation, to refusal skills, conflict resolution, problem solving, analytic thinking in dealing with many daily life situations which will form the reality of our children's lives as we negotiate this second wave and prepare in October, November for the third. Friends, from a systemic perspective, from a response perspective, from a judicial perspective, from a child protection and child rights perspective, this is not the best time for deinstitutionalization. We actually need to open the doors of our childcare institutions for children from severe deprivation and poverty to avoid families and children into resorting to unsafe activities. We've already seen this happening, and this is where our child welfare committees, our women and child departments, our CCIs need to scale up our services, even as a transit mechanism and as a medium to long term uh, alternative for children, so that these CCIs become safe places as a prevention and preparedness measure to avoid child protection risks, so that they can serve as supported places for children in this time of crisis till such times that normalcy returns. We are not talking about this as a permanent arrangement. We are talking about this as a transit arrangement, as a medium term arrangement till normalization takes place. This is because child protection interventions for vulnerable children involves exactly the kind of systemic mechanisms that form the subject of today's session. The capacitation of child welfare committees, of ICPS staff, and other child protection functionaries to actually conduct systemic home studies to evaluate families' capacities to provide optimum care to children, especially in the wake of the recent economic crisis. Please keep the child at the center of decision making. Is the child willing to go back home if there is abuse and neglect at home? Otherwise, we run the risk of the revolving door phenomena and the risk of re-trafficking. So check if the child is at risk for trafficking, for child labor, for marriage, for abuse and violence in the family context. We also need to assess the capacity of parents and caregivers to provide the child with basic needs. And this brings me to the mental health and well-being interventions for children in institutions and communities. And I invite my colleague and the technical and operational lead of SAMVAD, which is a national initiative and integrated resource for child protection, mental health, and psychosocial care under the Ministry of Women and Child Development of Government of India, to take you through the next stage of this session.
Thank you, Dr. Shekhar. So moving on from systemic protection interventions to mental health and well-being interventions, particularly for children in institutions, because they're cut off from their families, isolated from the community at large, but also extending to children in our open communities, in vulnerable households. If you look at the pyramid of interventions, right down at the bottom, you see maintaining social connections. This must be for all children, to allow for children, for example, in CCIs, to communicate via phone with whatever family members they have, at least a couple of times a week, so that they're reassured that their family members are there and things are okay at home to some extent. If this is not done, the fears and anxieties of children, particularly in the wake of the uncertainty they feel about, how people are doing at home, could increase and have several adverse behavioral consequences. And as we know, children have a right to communicate with their families. If repatriation to family is so big on our agenda, and that is difficult now to do for certain socioeconomic reasons, the least we can do for our children is to allow them to talk to their families and be in regular touch. It would make a lot of difference to their daily well-being. At a next level, mental health interventions entail responding to children's COVID-related queries and confusions. Again, the anxiety and fear that Honorable Justice Nagaratna referred to also emerges from the fact that we don't give children sufficient information about the nature of COVID. What is this illness about? You know, children hear all kinds of bits and pieces of information and adult conversations, and they internalize them in ways that lead to great anxiety because some of the information they have may not be correct. So it is important to provide this information in simple, age-appropriate ways. Samvad, for instance, has created a COVID story for children. That is one way to explain why we need to wear masks, what this illness is about, why we cannot go out during lockdown periods, because it's very hard otherwise for children to really understand these issues, and therefore even to adhere to any kind of COVID protocols you wish for them to adhere to in the interest of their safety. Uh, Next is maintenance of daily routines, you know, self-care activities, educational and academic work, leisure, recreation, rest, play, some physical exercise, yoga, to have a balanced routine so that children are gainfully occupied and engaged all day long. This serves uh, two purposes. One is that of engagement, active and engagement, but also, and very critically, when children are engaged, they have less mind space to be worrying and anxious about the disease and other related issues. Engagement in developmental activities, education, play, storytelling, drama, this is to keep children's developmental trajectories online. What this means is that, you know, when we have situations like the pandemic, or children are affected by life events and trauma, there is the risk of their developmental trajectories getting broken. In other words, at each age, children develop certain abilities. You know, at age 5, children are learning certain things in readiness to go to school. At age 7, 8, you know, there's increased language capacities for self-expression, etc. At age 12 and 13, you know, as children enter adolescence, they're moving into other developmental abilities. So in order to make sure that this chain is not broken, there are several developmental activities that we need to ensure that children receive. Then at a next level, anxiety management techniques, relaxation, guided imagery, deep breathing, yoga, you know, these are universal techniques that are used to help children and adults also manage anxiety. And you see at the top of the pyramid, for a relatively small group, let us say, of children who really are unable to cope and have issues of anxiety and depression, to be able to identify these red flags and to refer them to psychiatric facilities, perhaps at district hospital level, government medical colleges, and so on. Let's move on to the second wave and what it has already brought us. We already know that, or we perceive that there is an increased severity of the virus. There are higher levels of infectiousness. Therefore, there has been greater spread. Continued lockdowns in many states. And what characterizes this outbreak is that we were ill prepared because it was completely unexpected. The scientific community, government agencies have said, we never thought it would be like this. And we are also aware of then the high burden on public health systems. We are reading daily the many sad stories in the newspaper of the troubles that people are having, health systems and health workers are having in just trying to contend with this pandemic. And then finally, the increased loss of lives. One of the most tragic outcomes, please remember that in the first wave, mortality was largely restricted to geriatric populations and to those who had morbidities, other comorbidities in the wake of COVID. However, things seem to have changed a lot in the second wave. the age group that is suffering mortality has come down to young adults, people in the middle age group, healthy people who may or may not have had any comorbidities, perhaps because of the nature of the virus. Much research still needs to be done. Studies are ongoing. Our access to knowledge is still fairly limited, but this is what we observe. So, what does this mean for children? There are a whole host of new imperatives in child protection. In the second wave, as you are aware, parents dying in hospitals or homes, COVID orphans, children who are waiting alone for help. And, sometimes because of the tremendous fear and stigma of the illness, neighbors are finding it difficult to help. Relatives may or may not always have the ability in terms of finances and socioeconomics to take a child or to provide for an orphan child. The newspaper is filled with stories of very young children, sometimes left completely alone. There was one the other day of a toddler. It was a couple of days before he was found because both his parents had died. And then there is the risk of child trafficking, unfortunately created by well-intentioned, well-meaning citizens through social media messages. So while social media has tremendous advantages, there are also some drawbacks. Here are some of the messages that have been doing the rounds. You may have seen them. Please help these girls get a new life. 2 girls for adoption, a 3-day-old, a 6-month-old. Parents died due to COVID. Ladies and gentlemen, this is a problem because the knowledge of adoption and foster care services, of processes in this country, as we can see from such social media posts, is fairly rudimentary. Because India has not been a country culturally that has been very pro adoption and foster care, even in recent years, on the one hand. But we also know, on the other hand, however, that we have a long tradition of informal adoption. A combination of these two issues, almost contradictory issues, has put us in a fairly dangerous position now, where messages like this can place children at serious risk of trafficking when formal legal procedures are not followed to adopt or place children in foster care facilities. Where child psychosocial and mental health issues are concerned, the new imperatives are centered around illness, loss, and grief. So we are contending now with mental health professionals, child protection functionaries in institutions, caregivers of children in homes, at home, in families, who are finding it exceedingly difficult to respond to children in the context of illness and death. What do we tell children? How do we break bad news? Will the child be upset? Will the child be angry? Will the child be overwhelmed with grief? And if I tell him or her that, your parents are no more, they're never coming back from hospital, what will be the child's reaction? And fear and anxiety in children, contrary to what we believe, is felt even in very young children who may not have a cognitive understanding of what death means. How young children ask questions like, will mummy come back? Has she just gone to the market? I want mummy to come back now. And they keep waiting. And people are hesitant to tell them. Unfortunately, we as adults, because of our own discomforts and fears of death and of disclosure to children, fob them off and tell them things like, yes, wait a few days, mummy's gone somewhere, she will come back. Very problematic responses that can actually lead to increased mental health issues in children, because ultimately they will discover the truth. So these are some of the questions for us in mental health now. How do we deal with children of different age groups, very young children who develop clinginess, attachment issues, feeding and sleep problems, and other ways in which they express trauma, developmental delays due to experiences of trauma, adolescents, as Honorable Justice Nagaratna said, with their worries and their reactions that could come in the form of anger and depression. Anger sometimes not easily recognized, and forms a huge part of grief. So here are some of the child protection interventions that we could suggest in the wake of the second wave. One is public education campaigns. Many state governments are already putting out a lot of this information in terms of encouraging reporting of children, often children through police, child protection units, child welfare committees, and Childline, with a plea to the public and to concerned citizens to say, please use formal channels, to discourage social media posts on advertising children and their availability for adoption, to spread awareness on legal ways to offer foster care and undertake adoption. Other systemic responses could include support to child helplines. There are many child helplines that have mushroomed in recent months, all trying to do their best, from the NCPCR Childline to Childline, of course, the 1098 number, as well as several NGOs at state level who've started services to assist children. We could also look at ways to speed up otherwise lengthy and sometimes cumbersome processes in adoption and foster care to allow for children to be adopted by citizens who come forth. But we need to be judicious about this to ensure that, we don't compromise on children's protection and well-being. So for this, we need to really look at systematic training of social workers and adoption counselors to be able to conduct accurate home studies and, assessments of people who come forward for adoption, so that we ensure that our children go to safe homes and families. These are just some examples of what SAMVAD has put out countrywide on, adoption, on, what to do when you find a child that is not yours, children who are orphaned and so on. We will share these posters with you online. We have already done so on YouTube and Zoom. Child mental health interventions in the wake of the second wave. As we said, this is now about building skills of caregivers and childcare service providers in illness and disclosure, how to support children through grieving processes and bereavement, identifying symptoms of complex grief and referring them for further mental health assistance. Please know that in situations of complex grief and complex trauma, children can become almost dysfunctional and unable even to carry on with their daily self-care activities and so on. Helping children adjust to new homes, families, and institutions as per their placements. SAMVAD does training and capacity building activities on a daily basis around the country for child protection functionaries and mental health service providers. We have in recent weeks received several questions and cases on these issues, asking us, how to contend, especially in childcare institutions, with children who have been orphaned in the pandemic. Counselors have said, what do we say to these children? We still haven't told them, that their parents are no more. So in the light of all these questions that we have been receiving, and upon the request of the Ministry of Women and Child Development, we are running a COVID series, a special series in 4 parts starting 15th May. Everyone is welcome to join, although it is directed especially at caregivers and service providers. But since we believe that child protection and child mental health is everyone's business, especially in the wake of the pandemic, we welcome you all to attend this. The first 2 parts are on child protection. The first part, let's say, is on child protection, when we'll be talking about social investigation reports. We'll be talking about placement issues, guiding child protection functionaries on how best we can make these decisions in the pandemic. The second part of the series, Worries Fly Away, is about how do we help children at home and in institutions to do some of the things I presented to you earlier, how do we ensure their well-being through this difficult time. The last two series particularly pertain to the second wave. As I was just mentioning, Breaking Bad News and In My Heart Forever is about supporting children through grief processes. What is special about this special series is that we are actually going to be doing some training and skill building of the participants who register on Zoom, and people on YouTube can also participate and view the methodologies that we are going to be sharing with the nation in the coming weeks. Um, Moving on to the third wave.
And this is something that is particularly concerning, and it should be an issue that all of us should think about. Remember what Sheila said, in the first wave, it was the elderly with comorbidities that were a concern. In the second wave, we can already see that healthy adults are being affected. It is predicted in the third wave, which will hit in October, November, that children will be most at risk of COVID because they are unvaccinated. And the virus will need a susceptible host to occupy. The trials are still going on, the clinical trials for vaccinating under 18s, but the trials are not completed and no regulatory body will allow for vaccination to start. And this is where the already overburdened public healthcare systems will be further stretched. As I speak to you now, you're perhaps aware that the Supreme Court, as of yesterday, has set up a special task force of medical professionals to look at the situations. Several state governments are already looking at the whole issue of children's health. And this is where I think systems which include the child protection systems, care systems, as well as judicial systems, would have to take a call. Do we have enough pediatric ICU beds to really meet the need? That preparation has to be done now. Do we look at the whole picture of education and whether schools should be open and when they should be open? Because these are super spreading events. So this is the time that the judiciary and other systems that need the children have to consider all this, so that the predictions regarding the third wave are understood and the planning is done now rather than in October or November to reach a situation of predicament, consternation and surprise, that because this is the trend. And also to let you know, as my colleague Dr. Ravi from virology often says, that the best public health approach is common sense. And at the current point of time, there is no better vaccine than the mask for children. That we will, of course, be continuing, Samvad will be continuing with support services to all the helplines as we move out of the second wave into the third wave. In fact, in the coming week itself, for all official helplines, we will be starting telementoring. And all this is available through our communication channels. So please spread the word around that Samvad is committed to supporting all people who support children in the coming out of the third wave. So the need for preparation, friends, is now. Strengthening hospital facilities, especially pediatric hospital departments, bed ICUs, the development of new and additional protocols for hospitalization of children and isolation in the wake of caregivers needing to stay with the child. This is not like in adults who can stay on their own. So we have to start thinking and creatively planning right now and making the decisions and taking official positions right now. And how will childcare institutions respond to the preventive need, plus how to respond in case of an outbreak within the CCI. So we need planning and creative solutions for isolation of children prior to admitting them to CCIs. For example, CCIs temporary use of schools as isolation centers, if you can shut the schools, and they're vacant for this kind of use. And of course, the materials and methods for psychoeducation of children to help them cope with illness if infected. All this is ready, and all this we need to kind of prepare for dissemination so that all service providers and stakeholders are prepared when the third wave comes. And friends, it will come. Let me now address two things that happened. Please go back to April 2020 in the Supreme Court order. This was a suo motu writ petition, civil number 4 of 2020, in the matter of recontagion of COVID-19 virus in child protection homes. Quorum consisting of Honorable Justice Nageshwar Rao and Honorable Justice Deepak Gupta, where CWCs and JJBs were directed to proactively consider steps in the light of COVID while doing their inspection and inquiries. Safety health concerns. Considering that violence, including gender-based violence, may be exacerbated in the context of anxiety and stress, child welfare committees should monitor regularly. Video conferencing and online sittings of CWCs and JJBs can be held to prevent contact for speedy disposal of cases. The order also said that the governments circulate information to all CCIs about how to deal with COVID-19 immediately, with instruction about awareness, prepare for a disaster emergency situation, make provision to ensure that counseling is available, monitoring systems are available to prevent violence, abuse, and neglect, and ensure adequate availability of good quality face masks, soap, and disinfectants, and basic needs of children. But very interestingly, a Supreme Court order placed so much of emphasis on mental health of children by addressing ecology. The ecology of childcare institutions is not just a resources and child rights issue. It is a mental health issue, because when you ensure good ecology, good facilities and planning, you ensure that daily routines are maintained, you acknowledge children's anxiety, you help them maintain connectivity, you reassure them about safety, you monitor and titrate the amount of news they are exposed to, you encourage them to participate in activities they enjoy, and you identify children with distress so that you can counsel them and have networks with other service providers and professionals to keep their educational, developmental, and mental health needs intact. And now, in May 2021, the highlights of the 5th May 2021 meeting of the State High Court Juvenile Justice Committees, which deliberated on measures and actions that need to be taken to ensure that every child in need gets appropriate care and protection, particularly where there are concerns about the experience of loss of primary caregivers. And the Supreme Court said there's a need for a mechanism to address interim care needs of orphans, separated, and unaccompanied children, including a clear guidance on steps to be taken in a case child has been exposed to symptoms and needs isolation and treatment. The salient points of this meeting on 5th May: screening and testing and medical care of children in institutions, provision of emergency medicine, supplies, access to hospital, roster of doctors for teleconsultation, vaccination of all staff in CCIs and frontline protection workers, nomination of state and district level nodal officers empowered to take decisions and constitute a task force for rapid emergency response to children, and for orphan children, setting up of a committee in each district comprised of a nodal officer, district magistrate, representative of the concerned child welfare committee, district legal services representative, to ensure temporary foster homes, as well as gather and secure all information related to the deceased parents, sponsorship for children with lost parents or lost bread owners, and measures to stop spread in childcare institutions and medical treatment and care of children who have already contracted the disease. So April 2020, the Supreme Court order that came, and this is the 5th May. In this 1 year period, this is the journey that we have traversed. I would like to end by quoting what Honorable Justice Ravindra Bhatt, Chairperson of the Supreme Court Committee on Juvenile Justice, said. Please mark his words. Prevention of and response to the second wave of COVID surge requires close coordination and collaboration between child protection systems, health systems. A multi-sectoral response ensures that children and caregivers' needs are addressed holistically, and it leads to better outcome for children. I add to this, my friends, the fact that in October or November, there is likely to be a third wave, and the preparation that Honorable Justice Bhatt has referred to needs to extend to an anticipated third wave. And as I said, in order to provide assistance to helplines, mentoring, hand-holding, we are starting these telemetry services as part of SAMVAD. We are also starting assistance for case conferencing in case you have a child who has a mental health problem to service providers in childcare institutions. This brings me to the end of this presentation. I would like now to spend some time along with my colleague Sheila Ramaswamy of Samvad, that on a YouTube chat as well as on Zoom chat, if there are issues that you would like to raise, we will spend the next half an hour in addressing some of these questions and clarifications that you have or issues that you might want to share. I have also taken the liberty to put on both YouTube chat and Zoom chat the links to Samvad, the links to our social media handles, the links to the programs that we are going to be starting. Please subscribe to them, send them on to your networks so that the message of child protection spreads across the country as we negotiate this pandemic. It is also my honor and pleasure to tell you that as of now, we have almost 1,000 people on Zoom and YouTube put together who are watching this program and hearing it. And this program will continue to be available for those to watch on YouTube and on our channel, which is the Samvad channel. So we are open now to both questions that can be put on chat in YouTube or on Zoom.
Oh, this is ours.
अगर कोई हिंदी में भी प्रश्न पूछा चाहे तो निसंकोच आप हिंदी में चैट पे डाल सकते हैं.
ಕನ್ನಡ ತಮಿಳ್
ಅವಶ್ಯಕತೆ ಇದ್ರೆ ಕನ್ನಡದಲ್ಲಿನೂ ಪ್ರಶ್ನೆಗಳು ನೀವು ಕೇಳಬಹುದು. தமிழ்ல கேட்கணும்னா அதுல கூட பிரச்சனை இல்லை, தாராளமா சங்கோச்சம் இல்லாம தமிழ்ல நீங்க கேட்கலாம். We have recourse to several languages here, so please use the chat on YouTube or on Zoom to put your questions or anything that you wish to share on the session today. Dr. Ravi Ranjan wanted to inform that from a wider perspective, what precautions should parents take for seeing the third wave? Dr. Ravi, as I pointed out, at the current point of time, the vaccine has not been approved for the 0 to 18. The best vaccine is the mask. So Justice Nagaratna has always spoken about SMS, sanitize, masks, and social distancing. If this is practiced, this is the best vaccine that is available. We will also put, Sir, Dr. Ravi Ranjan, on our YouTube chat, a story that we had prepared based on COVID. We'll put it both on the Zoom link as well as on our YouTube chat and on the Zoom chat. A story that we had prepared to help parents negotiate the what we approach as the third wave. And you could please look at this link also. That
It's actually a story written for children, and COVID is explained in simple ways to address various questions they may have and what children need to do. So it has pictures and so on. So you could use that to start preparing children so that they really follow through with some of the precautions. That would be one. The other would be to look out for information that we hope will come in due course. Young children, particularly, cannot report symptoms. Friends, this is one of the major difficulties when we work with illness in children. So, as parents, as teachers, as caregivers, as child protection functionaries, to be extremely vigilant to children's feeding patterns to begin with, because when children are unwell, one of the first things they do is to stop eating. To also be vigilant to listlessness, restlessness, tiredness, any breathing difficulties that children may have, respiratory issues. These could be early signs. The point is not to get panicked. The point is to be vigilant so that you can seek help early.
मनोज वर्मा के द्वारा एक कमेंट है जहां वो कहते हैं कि छोटी बिटिया के देखभाल मेरे पूरे परिवार द्वारा करने की जिम्मेदारी लेता हूं जब तक उसे किसी अच्छे एवं सक्षम परिवार द्वारा गोद लेने की प्रक्रिया पूरी होती हो। मनोज जी, इतना कहना चाहूंगा, जहां तक कि दत्त का प्रश्न है, बिल्कुल जो कायदे कानून के अनुसार करें, कारा के नियम जो हैं, रूल्स और रेगुलेशंस. What I'm addressing to Manoj is that any adoption related issue should be done through legal processes as prescribed by CARA, the Central Adoption Resource Agency. If there are any issues pertaining to children who are unaccompanied, please contact Childline 1098 and other official sources, because illegal adoptions are a huge problem and it is tantamount to trafficking.
Also, adoption processes can be lengthier. You can approach the district child protection services and the child welfare committees to look at the option of foster care. That is also a formal process. Usually that lies with the child welfare committee, and that could even be an interim measure that families and children could be a part of before moving on to adoption, which has many more layers.
There are some comments on Zoom chat which we will take now. There is a comment from Madam Kaveri, Member Secretary, about a lack of coordination between various service providers. That you will remember the comment that Honorable Justice Nagaratna made about the importance of convergence. And convergence is exceedingly critical. And this coordination can be enabled both by, let's say, instructions or orders that come from governance systems, but they also occur from adopting a basic principle of social cohesion and social cohesiveness. That Justice Srishananda has a hand raised. Sir, would you like to make a comment? Please go ahead.
Yes, sir. Yes, sir. It's a more a query, sir, rather than the comment. Nowadays, we are seeing more number of hospitals are asking for whom the child to be handed over in the event of both the parents being lost in the COVID situation. There is no proper guideline on this, and the hospitals are also not expected to take that declaration in the beginning itself. because it will act as a negative aspect in the first place. And second is the child whom to be handed over is not the business of the hospital to decide. And in such cases, it is the child protection officer who would be informed, and he has to take care of the situation. How do we deal with such situations, sir?
Can I also come in on this?
Yes, ma'am. Please, ma'am.
After doctor, after you, sir.
Yes. As Justice Srishananda has pointed out, the job of the placement of the child is not the responsibility of the hospital. Their obligation and responsibility is actually to inform the child protection authorities uh, or bring it to the notice of Childline and the Child Welfare Committee. Placement orders are always done by the Child Welfare Committee to the appropriate institution based on the age of the child and the requirements of the institution. This is the procedure that needs to be followed uncompromisingly. Justice Nagaratna?
Yes. The government of Karnataka has passed a government order appointing a nodal officer of the IAS rank to take care of orphans on account of the death of their parents or caregivers. So when we had a meeting 2 days ago, we suggested that when either of the parent or a caregiver is admitted to the hospital, let there be a column taken in the where we take the diagnosis, etc., a column in the papers where whether that person has a minor child and to take the name, etc., details. And if just that much without anything more, and if that parent or caregiver dies, then that information must immediately come to the nodal officer who has been appointed. And then the system must be put in place as to how the help shall be rendered to the minor child. That is one thing which we have to appreciate, that the government of Karnataka has appointed a nodal officer, but there must be flow of information from the hospital to the nodal officer in a particular channel. And the data must be collected when the person is admitted in the hospital, whether that uh, patient has a minor child or not, and to just take the name and age. That is one way of having the data. Yes, over to you, doctor.
So, thank you, ma'am. We see another question on visitation rights. This is in the context of custody and separation issues. How do we ensure visitation? In these times, a physical visitation could be very difficult. So, to come to some agreement between the parents that the child could actually have FaceTime or time online with the other parents so that they can chat, and maybe that could be more frequent, because in a given situation, if a child goes for a visitation for a whole day, it's not possible to have the child online for that duration of time. So perhaps the courts could consider giving an hour and a half every few days for the other parent, the non-custodial parent, to be able to engage with the child, and parents could come to an arrangement on this, because it would be very difficult in these times to risk a child or a family's life in ensuring visitation physically.
There are a couple of comments on YouTube chat on improving the situation in observation homes, on strengthening adoption procedures. We recognize the significance of these observations. It's not just about observation homes. All childcare institutions need to be geared up now to supporting what are the requirements of children. And indeed, all systems and processes of adoption need to be put on along the lines of prescribed processes. There is a question from the Patna High Court asking if NIMHANS or SAMVAD can conduct direct interaction with children in childcare institutions through scheduled video conferencing so that they may be motivated in this tough times.
Sir, thank you for that question. Samvad is actually heavily engaged in training large groups of your child protection functionaries in Bihar. we would be very happy to do some special sessions for the groups that we are already working with and know so well and closely, to help them to provide the necessary responses and support to the children with whom they are in direct contact. So we will do that. We have taken note of it.
There's another question on the necessity to take steps to vaccinate children who are in observation homes and government homes, boys and girls. Let me repeat once again, the vaccination for children between 0 to 18 have not yet been approved. The trials are still going on, and no regulatory body will allow for vaccination to take place for those who are under the age of 18, because its efficacy and safety has not been established. So till such times that the reports of the trial comes, like I said, the best vaccine is the mask. And the best public health approach is common sense. That
And just to add to that, for children, sometimes just difficult to adhere. Why children, even for adults? Perhaps CCIs could be creative, and we'd be happy to discuss this. How do you make masks fun? And how do you do mask wearing in a creative way through games? Can we have colorful masks? Can we have, surgical masks that have color, that have animal pictures? So we may have a whole host of games that we can suggest, and we will, as we work through with the CCIs.
there are several suggestions on Zoom chat of how legal services authorities could take the steps to spread awareness in child protection homes, of the need for centralized data integration mechanisms for child rights, about what kind of steps the government could take to face the third wave. So whether it's possible to give directions or instructions by the government for arrangements to be made as preparation to safeguard the health of children. There are some more questions now about education due to COVID-19 and online classes in addition to mobile phones, and what can children there, and all these news channels and mobile phones. So screen time, that kind of stuff. So yes, there are several mechanisms about screen time and prescriptions about age-based exposure to screen time. And see, online education cannot be wished away, given and online education had come to stay even before the pandemic. The Indian Academy of Pediatrics, the Indian Association of Child and Adolescent Mental Health, the American Academy of Pediatrics, all of them have guidelines about screen time, whether it's television or whether it's online education. That for preschoolers, maximum 60 to 90 minutes of screen time, and that too not continuously, in 5 to 6 gaps. 6 to 10, perhaps 1 to 2 hours, 10 to 14, maybe 3 hours, and then, but again, in pockets of half an hour, 40 minutes each, not continuously there. And how do you have a family viewing plan? How do you use screen time also to keep extended contact with the family? So it's not just about passive stimulation, it's also about maintaining social skills going there. So that's the kind of approach that we take to really reduce the negative consequences of screen time.
There are some questions about disclosure of death of a caregiver and timelines. More than timelines, it is about disclosing in a phased manner to children. So the idea is not immediately after to say, well, your parents are dead, or your father is no more. Of course, that is one way, and children may know that. But when we do disclosure to children, we look at several factors, or we have a framework. That framework essentially is about considering the age of the child and the developmental stage. Is this child 4 years old, 5 years old, or is the child 9 or 10? because children below the age of 7 do not actually have an understanding of death. It is only then that they develop it. The second consideration is about telling the truth and presenting facts. But along with it, the third consideration is about providing comfort, reassurance, and hope. So, how do we provide information, or how do we disclose illness or death to children? By telling the truth, no lies, but at the same time, ensuring that they don't get into a situation of hopelessness or depression in as far as possible, but feel reassured. So, disclosure, therefore, friends, is not a one off process. It occurs with children, especially young children. It is done in a phased manner. Every day, a little bit of information is given. For example, when we want to talk about the death of a caregiver, there are several things we talk about before, illness, uh, big sicknesses, small sicknesses, different types of sicknesses. What are sicknesses that are simple and, we all recover from? What are bigger illnesses that we don't recover from? Those that doctors try to treat and that they're not able to treat, and then gradually move into saying, your father, your mother had this kind of an illness, and then to deal with questions children have after that primary disclosure is made. Like I was saying, especially to young children, when they have questions about uh, where do people go after they die, will they come back, can they eat, etc. So it's a detailed discussion for another day, and we have already scheduled this day both in English and Hindi. We've shared with you the posters. So for those of you who are curious and would like to know more about disclosure and grief processes, please do join our special series that starts on the 15th of May.
So,
Doctor, I have a question here.
yes, ma'am.
With regard to additional steps to be taken vis-a-vis this COVID, um, in the case of children already suffering from mental disability, what additional steps have to be taken? How to impress upon them?
Uh, there are two issues, ma'am. There is mental health issues or mental illness,
Yes,
and there is disability, which includes intellectual disability, children with locomotor disability, autism, what we call as special needs children,
yes,
or
yes.
children with special needs. That and it's particularly important that you're raising this issue, because there's a similar issue put on Zoom chat also from Dakshin Kannada about endosulfan affected children and who are at risk, and parents have been affected and they would need special attention and so on. So how to address some generic issues we have already covered, but special needs children and children with mental health issues such as anxiety or more severe mental health problems, there are several things that are being done. As we talk, for example, from the central government, there has been a convergence of the health ministry and women and child ministry to really look at the helplines and how they recognize mental health issues in the kind of calls that they receive, and if it deals with serious mental health issues, how that can be triaged or escalated to specialized mental health services. This is already taking place that as we speak. We are also from Samvad happy to actually assist service providers if there are issues related to special needs children. Um we are already doing this, for example, for young children and for children with disability, and we would be happy to extend this service.
Manoj ji has a question on post-adoption information. We will share with you our adoption links. We already have. There are a series of videos that are meant for caregivers on what to do post adoption. You know, having brought the child home, how do you create attachment, bonding, help older children to adjust to the family environment? And these would be critical issues, sir, as you have pointed out, as people come forward in the context of adoption and foster care. It's not just about taking the child home, but dealing with the child's previous trauma, helping the child adjust to the family. So we have a whole series on this that we have put out for you. It's also available on our website in English and Hindi. So please feel free to share that.
And before I invite Justice Mustafa Hussain, who has his hand raised to speak, I just wanted to reassure Zeba Parveen, who said, "एक request है sir, सारी बातें को हम लोगों को जागरूक करने की ये बातें अगर अंग्रेजी के अलावा हिंदी में भी होती तो बहुत अच्छा होता." तो ज़ेबा आपा, जो कोविड का सीरीज जो है 15 तारीख से जो हम शुरू कर रहे हैं वो हिंदी में भी उपलब्ध होगा। लिंक्स हमने चैट पे डाल दिया है, तो जरूर उसको देखिएगा। और जितने भी हिंदी भाषी लोग हैं सबके पास ये लिंक भेजिएगा। ये 4 सत्र में है और सबके लिए इसका फायदा होगा। फर्स्ट आई इनवाइट जस्टिस मुस्तफा हुसैन फॉलोड बाय जस्टिस श्रीशा नंदा फॉर देयर इंटरवेंशंस। ओवर टू यू जस्टिस मुस्तफा हुसैन।
Good afternoon, sir. I am Mustafa Hussain, Principal District and Session Judge from Shimoga. Sir, we have discussed about new orphan children and the process of adoption in the due course. Sir, my one suggestion is here. My suggestion is there, sir. Before this process of adoption takes place, we have to ensure some mechanism for the care and protection of these new orphan children. Because if there is any lapse in this area, it may lead to child trafficking, number one. Number two, at the same time, we have to ensure that the properties of these new orphan should be protected simultaneously. Because if this area is also ignored, some persons may come as sympathizers and they may claim, show the sympathy to the new orphan children. And under the guise of taking care, they may tomorrow deprive this new orphan of their ancestral properties. So therefore, my suggestion is that these two areas have to be looked into.
Thank you very much, sir, for that intervention. Thank you very much. Justice Shishananda?
I was on the same issue. Actually, the court guardian is to be immediately appointed for protection of the properties of the minor child are concerned in the event of both the parents being not there. So the concerned CDPO or the persons who are caretaking the child for the time being must not only disclose that this is the position, but also immediately a step is to be taken. Of course, Legal Services Authority will be of great use in that for appointing the court guardian to take care of the properties of such children. Otherwise, it is possible that some uncle, somebody else may try to take away and then sell off the property. And thereafter, after the child attains the 18 years of age, the challenge has to take place. By then, what would be the situation? Nobody knows. That too, if the child is advised that he can file the petition for restitution of the property within 3 years after attaining the majority. So this is an important area where majority of the family members are suffering from the COVID. Nobody wants to come, and there may be issue the fixed deposits in the banks and liquid assets. That will also to be taken care of. Therefore, necessity has arisen in such event where both the parents are affected with the COVID. Immediately, Legal Services Authority should take care of these aspects of the matter in appointing the court guardian.
There is another.
Yes,
thank you very
correct.
much, sir. Thank you very much.
Father.
Justice Nagaratna?
In fact, the Legal Services Authority has its member secretaries in each district and in the taluk level. So they could be helpful in collecting the data of the children who have lost their parents or caregivers. And that will help in further making a template of all the support services that they require when they lose their parent. It's not just the property. If their parents are in government service, they would be entitled to compassionate appointment. Then they should do it within the time frame mentioned under the rules. Otherwise, they will lose out. And similarly, the other aspects of such orphan children, their school fees would have to be paid, for example. Otherwise, their name may be struck off from the school register. There are so many immediate and long-term issues with regard to orphan children. But for that, we need data first. No doubt we have a nodal officer sitting in Bangalore who has been appointed by the state government. How does he get the data of children who have lost their parent or parents or guardians or caregivers, whether in the homes or in, that is, the observation homes or the CCIs, or who are living in their own homes? This is the most important. Collection of data is most important. There must be a channel where we get right from the hospital directly to this particular what we call a data bank. Unless we have the data or the information of the child in need of such services or account of the loss of a parent or parents or the caregiver, we cannot reach out. So this gap must be first systematized, is my considered view. Thank you, Brother Shishananda.
I'm given to understand there are some questions about street children. Actually, the Karnataka High Court had, in response to a PIL, not strictly in the context of COVID, taken up the issue of the many street children to look at where they were from, how many of them belong to migrant labor families, what facilities they had access to, and what difficulties they have. This initiative, which was being spearheaded by Honorable Justice Oak, had also been supported by SAMVAD. We had trained a lot of citizen groups and volunteers to be out there on the streets in what the police had identified as hotspots for these kids, just to start developing a database, not to immediately get into action. Justice Oak was very clear that we should only understand the problem first. But while some of these initiatives could be taken in other parts of the country to look at the issue of street children, and I think the Karnataka High Court would be happy to share how they went about it in collaboration with the Karnataka State Legal Services Authority, who took a lead on this initiative. Now may be a difficult time for something like this. So in the current time with the lockdown and so on, anybody who sees street children can again, contact 1098 or the police to see how they can access transit shelters or CCIs in order to remain safe.
In fact, the point that Justice Nagaratna made about data is kind of echoed by a comment put on YouTube chat by Subhash Chandra Sharma, where he says a data grid is required to be developed with an active dashboard for coordination between stakeholders, including hospitals, for better care and monitoring of children in need of care and protection and children in conflict with the law there. So this, my friends, was a special session that we wanted to organize as sitting in Bangalore. We are in the grips of the second wave, and as you're all aware, perhaps from newspaper reports, we are going to be going into a total lockdown from tomorrow because of the number of infections that we have. And indeed, this is the reality in many parts of this country. This session was particularly organized to look at protection risks of children given the status of the pandemic and how different systems, the state system, the judiciary, the education system, the mental health system, the health system, can respond to this really challenging times to ensure that children's lives are not just protected, but also contributed to in a manner that we keep their developmental trajectories intact. We thank you for your presence, both on Zoom as well as on YouTube Live. We'd also like to say that the recording will be available on YouTube Live in the Samvad channel for anyone who wishes to have a look at it. It would also interest you to know that these were not just the 1,000 people who have watched today, but there were at least 2,500 others who actually came in onto the YouTube and will presumably watch it at some point of time later. So it has been a very important program. Having said this, Justice Nagaratna, from your side, is there anything that you'd like to share with us as your parting words before we close the session?
At the outset, I would like to thank Samvad, Dr. Shekhar Sheshadri's team, Madam Sheila Ramaswamy, for this wonderful presentation that was made, which has given us an insight as to the approaches that are required on various problems. Secondly, I also thank all the persons who have been online or are going to watch, taking time off on a Sunday morning and ultimately benefit from your talk, and to put it in a meaningful way as far as action is concerned, particularly those of us who are able to make a difference for the children. Thirdly, I would like to request Dr. Shekhar Sheshadri and his team, Samvad team, as to whether this program could be replicated in Hindi, so and possibly in any other language which you can, statewide, Tamil, Malayalam, Telugu, etc., or Bengali, etc., so that whatever you have presented in English could also be written in Hindi, and any juvenile justice committee could approach you for making a presentation in the Indian languages, so that it will have a greater effect and impact. So I once again thank you, Dr. Shekhar Sheshadri, Madam Sheila Ramaswamy, and Samvad, and all the honorable participants who have been on the screen through their presence, and everybody else who would be watching it thereafter. Thank you.
Thank you very much. And from the Samvad side, please be safe and look after yourself. We wish you all the best of health. And we will be back with you on news about a Hindi presentation of the same subject, and indeed in all other languages. Good day to all of you.
Good day. Thank you.
Thank you very much.
Thank you, brothers and sisters.